I want to talk about the places of articulation of the IPA, the International Phonetic Alphabet. Before we get it started, I think it's necessary to ask ourselves this question. That is, what and why do we need to learn places of articulation? Well, the reason of being is that it helps us to understand how sounds are made, specifically how consonant alphabets are pronounced, which is those consonant sounds are made by the restriction of airflow from the positions between passive and active articulators. It also helps us to classify those consonant sounds into categories for us to have a better holistic overview on the phonetic and phonology study. In today's talk, we are going to look at those 8 places of articulation. They are called bilabial, labiodental, dental, alveolar, palatal alveolar or post-alveolar, palatal, velar, and glottal. So the bilabial sound, it is a sound that is made by a moment closure between the upper and lower lip. The sound B, it is a voiced bilabial stop. It is pronounced by pressing both lips together to block airflow, then releasing it with vocal cord vibration. The sound M, it is a voiced consonant. It is pronounced by closing both lips to block airflow in the mouth, while the soft palate lowers to allow air to escape through the nose. The sound P, it is a voiceless bilabial stop. It is pronounced by bringing the lips together to completely stop airflow, then releasing the air in a sudden burst. The labiodental sound. The labiodental sound is a sound that is made by restricting the airflow through the contact of the lower lip and the upper teeth. The sound V, it is a voiced labiodental fricative consonant. It is pronounced by placing the bottom edge of your top teeth gently against your lower lip, then force a stream of air through the small gap, creating a buzzing sound by vibrating your vocal cords. The sound F, it is a voiceless labiodental fricative. It is pronounced by bringing the lower lip into contact with the upper front teeth, forcing air through this narrow opening to create a friction and noise. The dental sound. The dental sound is a sound that is made by restricting the airflow through the touch of the tip of the tongue with the upper teeth. The sound S, it is a voiceless dental fricative. It is pronounced by placing the tip of the tongue between the upper and lower teeth, allowing air to pass through to create a friction sound without vocal cords vibration. The sound Z, it is a voiced dental fricative consonant. It is pronounced by placing the tip of your tongue between your teeth and vibrating your vocal cords while forcing air out with friction. The alveolar sound. The alveolar sound is the sound that is made by restricting the airflow through the touching or approximant between the blade or tip of the tongue and the alveolar ridge. The sound t. It is a voiceless alveolar plosive. It is pronounced by placing the tip or blade of the tongue against the alveolar ridge to briefly block airflow from the lungs before releasing it with a small burst of air. The sound d. It is a voiced alveolar plosive. It is pronounced by the tongue tip or blade. The tongue tip or blade touches the alveolar ridge to block airflow, then releases the air while the vocal cords vibrate. The sound z. It is a voiced alveolar fricative sound. It is pronounced with the tongue tip or blade near the alveolar ridge to create a narrow channel for turbulent airflow, while the vocal cords vibrate to create a buzzing sound. The sound s. It is a voiceless central alveolar fricative. It is pronounced by the vocal cords do not vibrate. The air flows through the center of the mouth, and the sound is produced with a partially obstructed airflow that creates a characteristic hissing sound. The sound l. It is a voiced alveolar sound. It is pronounced by placing the tip or blade of your tongue against the alveolar ridge, while letting air flow out around the sides of your tongue. The sound r. It is pronounced by the vocal folds vibrate, and is produced by forcing air through a narrow fluttering gap between the relaxed flat tongue tip and the alveolar ridge. The sound n. It is pronounced by the tongue tip touches the alveolar ridge, that is the bump behind the top teeth, to block airflow through the mouth, while the air is released through the nasal cavity, that is the nose, and the vocal cords vibrate to create a voiced sound. The post or palatal alveolar sound. The post or palatal alveolar sound, it is a sound that is made by restricting the airflow through the touching or approximate between the blade of the tongue and the palatal or post alveolar. The sound r. It is pronounced by placing the blade of the tongue just behind the alveolar ridge, that is the bumpy part of the roof of your mouth, forcing air through a narrow gap to create audible friction and vibrating your vocal cords. The sound sh. It is pronounced by the blade of the tongue comes into contact with this post-alveolar region, creating a narrow constriction that produces a hissing sound when air passes through. The sound ch. It is pronounced by first completely stopping airflow with the tip or blade of the tongue behind the alveolar ridge. It is the bump on the roof of your mouth, and then releasing it with friction, creating a sound like in the word church. The sound j. It is a voiced affricate, where the tip or blade of the tongue makes contact just behind the alveolar ridge, that is a bony ridge behind the upper front teeth. Airflow is initially stopped, then released with friction, accompanied by vocal cord vibration, creating the sound like in the word jump. The palatal sound. The palatal sound is a sound that is made by restricting the airflow through the touching or approximant between the front of the tongue and the hard palate. The sound it is pronounced by the body of the tongue raises high in the mouth and approaches the hard palate, creating a narrow space for airflow, but not fully obstructing it. The sound is voiced, meaning the vocal cords vibrate during its production. The velar sound. The velar sound is a sound that is made by restricting the airflow through the touching or approximant between the back of the tongue and the velum. The sound k. It is pronounced by lifting the back of the tongue to touch the soft palate, that is a velum, completely obstructing the airstream and then quickly releasing the tongue to allow a burst of air to escape. The sound it is pronounced by raising the back of the tongue to touch the soft palate, that is the velum, completely blocking airflow through the mouth, allowing air to escape through the nasal cavity. It is a voiced sound. The sound g. It is pronounced by lifting the back of the tongue to make contact with the soft palate, that is the velum, completely obstructing airflow to build pressure and then releasing it in a voice burst of air while the vocal cords vibrate. Finally, the glottal sound. The glottal sound is a sound that is made by airflow go through the vocal tract with the opening of the vocal cords. The sound is a glottal sound. It is pronounced by the voice box, that is larynx, is constricted, allowing air to pass through the vocal cords, that is glottis, with some friction, resulting in an aspirated sound. That means the glottal sound is made by vibrating the vocal cords, meanwhile without any other articulators to obstructing the vocal tract. Alright, that's it.